Senior Wellness Hub has spent considerable time examining one of the most overlooked yet scientifically documented areas of personalized health. And what has emerged from that research is something every person over the age of 50 needs to hear clearly and without distraction. There is a single piece of biological data that nearly every person in the developed world has had access to since birth. A piece of information sitting on a card in a drawer or buried in a hospital record from decades ago. And yet it remains one of the most consistently underused indicators available to modern preventive medicine. That indicator is your blood type. Not as it has been popularized by diet culture or wellness influencers, but as it has been studied and documented in peer-reviewed epidemiological research spanning hundreds of thousands of patients tracked across multiple decades. What that body of research has increasingly confirmed is that your blood group leaves a measurable and specific fingerprint on how your cardiovascular system ages, how your brain sustains function under pressure, how your immune system responds when placed under serious biological siege, and statistically speaking, what is most likely to become your primary health threat if you do not take deliberate and informed action early enough to matter. Beginning with type O, which is carried by roughly 45% of the global population and is the most common blood type on Earth, the research presents a picture that is both reassuring on one front and deeply underappreciated on another. Type O blood is associated with lower circulating levels of von Willebrand factor, a protein central to the clotting process, and the downstream effect of that lower clotting activity is smoother blood flow, reduced platelet aggregation, and a statistically meaningful reduction in the risk of arterial blockages that cause heart attacks and ischemic strokes. Multiple large-scale studies have confirmed that type O individuals carry a lower risk of coronary artery disease when compared to those carrying type A, type B, or type AB blood. That cardiovascular advantage is real and it is significant. But Senior Wellness Hub wants to be direct about something that most general health discussions entirely miss, which is that this cardiovascular protection can function as a psychological trap. Type O patients in their late 50s often present with normal blood pressure, manageable cholesterol, and no family history of cardiac events. And because they feel biologically protected on the cardiovascular side, they stop monitoring the systems that are quietly deteriorating elsewhere. The primary vulnerability for type O individuals does not originate in the heart, it originates in the gut. The stomach lining of a type O individual expresses surface receptors that the bacterium Helicobacter pylori attach. Type O individuals over the age of 55 who have never been tested for H. pylori should treat that conversation with their physician as the single most important health priority of the year. The test is simple, inexpensive, and directly relevant to their specific biological profile. Moving to type A, the gap between what people generally know about this blood type and what the clinical research actually shows is wider than for any other group. Type A emerged as human populations transitioned toward agricultural living, with denser settlements and broader exposure to infectious agents driving the immune system, to adapt toward a more aggressive and targeted response, particularly against viral pathogens. In younger years, that immune profile is a genuine asset. But by the sixth decade of life, the same biology begins to present a compounding set of cardiovascular risks that are not adequately communicated in routine medical settings. Type A blood carries elevated coagulation activity. The platelets are stickier and the clotting proteins are more persistently active. A landmark study conducted through Harvard University and tracking over 800,000 adults across a period of 20 years confirmed that type A individuals carry a 5% elevated risk of coronary heart disease compared to type O individuals. That number appears modest in isolation, but its clinical significance expands considerably when you account for the hormonal environment in which type A blood is operating. Type A individuals maintain the highest baseline cortisol levels of any blood type, and cortisol, when chronically elevated, does something very specific and very dangerous to arterial health. It inflames and progressively stiffens the endothelium, which is the thin cellular lining of the blood vessels, and an inflamed and inelastic endothelium becomes exactly the kind of surface that sticky, hyperactive platelets preferentially adhere to. The elevated coagulation activity of type A blood and the cortisol-driven endothelial inflammation of type A physiology are not two separate and independent risk factors operating in parallel. They are a compounding cycle in which each element actively amplifies the danger presented by the other. For type A individuals, stress management is not a lifestyle preference or a wellness recommendation. It is direct cardiovascular medicine addressing the same physiological pathway as blood pressure medication and cholesterol management. Blood pressure monitoring every 6 months rather than annually is appropriate for type A individuals over 55, and including homocysteine in routine blood panels as a targeted and evidence-based intervention. Given that type A individuals trend toward elevated homocysteine levels, an amino acid that when high actively damages arterial walls, and one that responds well to adequate folate, B12, and B6 found in dark leafy greens, eggs, legumes, and lean proteins. For type B, the research presents a blood type that conventional medicine has struggled to fully characterize, and that mainstream wellness culture has frequently handled poorly. Type B emerged among nomadic populations traversing the interior of Central Asia and the Himalayan region, people whose survival depended on constant adaptation to new food environments, new climates, and new infectious pressures. The result was an immune system with genuine and documented metabolic flexibility, capable of processing a wide variety of proteins, fats, and carbohydrates without the inflammatory friction that other blood types sometimes generate in response to dietary variation. However, what the research also shows is that type B individuals have a measurably distinct gut microbiome composition, and that specific dietary inputs common in the modern food supply, including refined seed oils, ultra-processed foods, and high fructose corn syrup, appear to generate stronger systemic inflammatory responses in type B individuals than in other blood types. This means that the same food environment that other blood types may tolerate at a moderate level of consequence can function as a significantly more potent trigger of systemic low-grade inflammation in type B individuals. The kind of chronic subclinical inflammation that runs beneath the surface for years and progressively disrupts immune precision. Monitoring C-reactive protein levels at least annually is a foundational and evidence-backed protocol for type B longevity, and a consistent reading above 1 milligram per liter in the absence of acute infection is a meaningful clinical signal warranting further investigation. For type AB, which is the most recently evolved blood type in human history, and the product of populations carrying type A and type B antigens mixing at scale, the research presents a profile of notable immune tolerance, combined with a neurological vulnerability that has become increasingly difficult to overlook. Type AB individuals show reduced inflammatory responses to certain environmental antigens and carry a meaningfully lower risk of some gastrointestinal cancers compared to other blood types. But type AB individuals also carry a statistically elevated risk of cognitive decline, including vascular dementia, compared to type O individuals. The mechanism is cerebrovascular. Elevated coagulation factors inherited from the A component of this blood type, combined with the cardiovascular complexity of the full AB antigen profile, create subtle but cumulative changes in blood flow through the brain's smallest capillaries over the course of decades. These are not dramatic blockages, but microscopic and gradual reductions in perfusion efficiency across neural tissue, responsible for memory consolidation, processing speed, and executive function, changes that accumulate silently for 15 to 20 years before becoming outwardly apparent. For type AB individuals, every intervention that protects cardiovascular health is simultaneously protecting cognitive longevity. And two specific daily behaviors carry outsized importance, which are adequate intake of DHA through fatty fish or a physician-discussed supplement, and consistent sleep of 7 to 8 hours per night, which allows the brain's glymphatic system to perform the metabolic waste clearance that prevents the accumulation of the proteins associated with neurodegeneration. Finally, the Rh factor, the positive or negative designation that accompanies every blood type, carries its own clinical relevance that almost no mainstream health content addresses. Approximately 15% of people are Rh negative, and emerging research suggests this group may carry a modestly different cytokine signaling profile that results in heightened sensitivity to certain inflammatory triggers, making the anti-inflammatory protocols relevant across all blood types even more important to implement rigorously for Rh negative individuals. What Senior Wellness Hub wants every viewer to understand clearly is that these statistical risk profiles are real, they are documented, and they are not a predetermined outcome. The gap between genetic predisposition and actual health outcome is not a small margin. It is an enormous space filled entirely by consistent, informed decisions made over years, and that gap is exactly where your health is won or lost.